Our planet is facing ecological changes. Impacts of population growth, urbanization, biodiversity loss, and pollution are being felt on all continents, undermining the foundation for human health. These changes bring the environmental risks of epidemics and pandemics. The 21st century will be focused on the prevention and control of infectious diseases. The risks are real, increasing in scale and frequency, and will continue without a targeted approach. The key is surveillance. In addition to providing essential health services, strengthening surveillance will be a critical factor in reducing the risk of health emergencies and enabling communities to be ready for and more resilient to tomorrow's threats. We'll need a renewed consciousness to act quickly and a joined force backed by technological evolution. Let's listen to our sister and brother UN agencies and partners on how they can contribute to the future of surveillance.
Hi, I'm Von Nguyen, the Clinical Lead for Public and Population Health at Google. Say you're searching online about a fever, or you visited a grocery store, or you inadvertently came into contact with someone infected by COVID. Novel data signals are being created every day, and they can be used to understand disease in new ways. When most people think about Google and novel signals, they think about Google search. To use these signals for help, we built the COVID-19 Search Trends Symptom Dataset, which brings together aggregated, anonymized trends for more than 400 signs and symptoms of disease and common health conditions. The dataset can be used to study search trends related to COVID-19 and the secondary health effects of the pandemic. Using this tool, we saw that U.S. searches for anosmia, the loss of the ability to smell, illustrated with the blue line, peaked in March of 2020 and followed this undulating pattern. This roughly tracked with COVID-19 surges shown by the red line. Can patterns of symptom searches be used as a novel signal for infection? Early in the pandemic, many public health authorities put in place stay-at-home orders to limit transmission of COVID-19. We didn't know much about the virus, and we did not have vaccination or treatments available. There was less traffic on the roads, but how could you empirically measure if citizens were staying at home? Well, it turns out the same technology that tells you if a restaurant is busy could be used as a novel signal to help public health authorities understand if their stay-at-home policies were working. We created a tool called the Community Mobility Reports to show if people were staying at home, going to parks, passing through transit stations, or visiting parks. These novel data were useful to public health officials for guiding public health actions in response to mobility route patterns within communities. They gave some insight to public health officials on how the public was responding to these actions. Researchers also used these data to publish over 3,000 papers with reference to community mobility reports in 2 years. Finally, when contact tracing systems were overwhelmed, we partnered with Apple to build a tool that uses privacy-preserving Bluetooth technology to notify strangers if they came into contact with a COVID-19 positive individual. This is a new use of cell phones to create a novel public health signal. But that's not the only novel public health signal I want to talk about. With the widespread arrival of rapid diagnostic testing for COVID-19, individuals skipped the doctor's office, they skipped the pharmacy, and the laboratory to self-administer COVID tests at home. Laboratory testing began to undercount cases. Fortunately, some individuals who use home diagnostic testing reported their COVID-19 positive status through the exposure notification app. Local public health officials are collecting these novel signals now and exploring how to interpret results. Enormous quantities of new data are being generated every day. Working with novel signals requires a commitment to preserving privacy. We at Google have long-standing privacy-preserving policies to protect users, while constantly innovating on privacy-preserving techniques. With this focus on privacy, the identification of novel signals can be used to inform important public health actions.
Hello, I'm Jacqueline Wekers, the Director of Migration Health at the International Organization for Migration, IOM. It's a pleasure to be here with you today. We are going to talk about strategic and effective disease surveillance, in particular the links between health security and human mobility and the importance of looking at those two things together. IOM has more than 7 decades of providing health services throughout all phases of the migration process. Today, we have over 300 migration health projects across 118 countries. We support governments and communities to build health systems that are migrant inclusive and to respond to outbreaks from a mobility perspective. Migrants and mobile populations include displaced labor migrants, students, truck drivers, and internal migrants. That is 1 billion people on the move with different vulnerability levels. We also focus on their host communities and travelers for effective disease surveillance. We do this across the mobility continuum, from points of origin to destination, congregation points like schools, places of worship, markets, and health facilities. Migrants are drivers of development and instrumental for the social and economic well-being of societies. They can face health risks during and after their journeys due to exploitation, harsh living and working conditions, discrimination, and many face barriers in accessing needed health services. Multi-sectoral and mobility-sensitive action is needed for effective disease surveillance that excludes no one. Data is key for effective surveillance and strategic decision-making. For countries to meet the requirements of the international health regulations, we need to improve the knowledge base. We use tools such as the IOM displacement tracking matrix, population mobility mapping, integrated disease surveillance and response. One way IOM helps to address the data gap is through population mobility mapping, or PMM. This includes a participatory mapping exercise, monitoring of population flows and site evaluations. The goal is to help understand mobility dynamics and trends and identify priority communities and locations that may be vulnerable to infectious disease outbreaks and other health threats. Examples of mobility-focused surveillance interventions include PMM during Ebola outbreaks in sub-Saharan Africa and in dozens of countries for COVID-19. And community surveillance, contact tracing, syndromic surveillance in Mozambique, Panama, and Burundi. Other examples include points of entry capacity building in West Africa and elsewhere, screening and referral at points of entry, congregation points, host communities, border areas, along migration corridors, or pre-migration health assessments. IOM has 69 such centers covering some 500,000 assessments per year. IOM has developed a Health, Border and Mobility Management Framework, or HBMM. It provides an overview of best practices for health security to help enhance the evidence base on the human mobility dimensions of communicable diseases, build health system and border health capacity, empower migrants, promote mobility-sensitive policies, and strengthen cross-border coordination. The HBMM framework aims to help governments, local authorities, health and non-health practitioners, communities, NGOs by strengthening surveillance, among other things, through a mobility lens. Disease surveillance must leave no one behind to truly contribute to smart public health decision-making. Thank you very much. I look forward to the discussions and learning from others here.
Hello everybody, I'm Maria Brovelli, Professor of GIS at Politecnico di Milano, and I will present how my colleagues and I, in collaboration with Areo, the provider of emergency medical services in Lombardy region, use geospatial information in the fight against COVID-19. In the spring 2020, the situation in Italy was highly troublesome, being the first country in the Western world to face an endemic outbreak. After the temporary institution of a red zone around the municipality where the first cases were recorded, in a couple of weeks, our government was forced to declare a full lockdown in the whole country. During the pandemic, we all experienced spending a lot of time searching for information, and we became acquainted to dashboards and infographics. Among the different kinds of information, one of the most effective and immediate were maps, which are largely used to rapidly communicate how the situation is evolving with a spatial perspective. However, spatial data can be used for more than simple description. Already back in the 19th century, Dr. Snow managed to control an outbreak of cholera in the city of London with geospatial information, identify the wells serving infected waters thanks to the mapping of infectious cases. Similarly, Thanks to our collaboration with Areo, we decided to go further than the simple visualization of spatial data, exploiting new technologies to organize data and information and to transform this information into knowledge, with the aim to provide evidence-based support for policy and decision makers in public health. The main data sources was the georeferences database of ambulance dispatches provided by Areo. But along with it, we had a lot of open geospatial layers, such as roads, buildings, land use, pollution concentration, and satellite imagery, such as those of the Copernicus Initiative, giving us the chance to explore different aspects of the pandemic. Using machine learning algorithms, we implemented an early alert model, as you see in the maps reported, with high granularity capable of anticipating by a few days the increase in the demand of ambulances in each municipality, representing available support both to monitor the evolution of the pandemic and to allocate the resources. It was possible to study the correlation between the velocity of the COVID diffusion and environmental pollution. A spatial characterization of the territory allowed computing clusters of similar areas, resulting in the identification of the correlation with the levels of ammonia, something new in literature, where a correlation with PM was only recorded. These are just some examples of GIS and data science applied to health data, an approach that can be used in other health fields. In particular, it is possible to study in a new way the impact of environment on health, identifying actionable drivers that can lead to the implementation of prevention policies through data-driven decisions. Despite the tragic emergency that COVID generated, it was also a chance to enlighten the importance of geospatial data, boosting the development of data-driven geospatial frameworks for public health. It is now up to us to make the best of this chance, especially considering the upcoming scenario of digital twin Earths.
In light of recent COVID-19 pandemic, we must improve preparedness and reinforce health security worldwide. Genomic surveillance is absolutely critical for early identification of emerging pathogens as well as preparation for any future outbreaks. We must leverage existing capacities, address barriers, and strengthen the use of genomic surveillance in the detection, monitoring, and response to public health threats. With the advent of COVID-19 pandemic, there has been a surge of public, private, and philanthropic investment in pathogen genomics to support sequencing for disease surveillance. However, now we must invest in collectively in pathogen genomic surveillance and better orchestrate and optimize our investment strategies. We still need to solve for fragmentation of available bioinformatics platforms because this is causing confusion, which may slow down capacity building efforts for all of us. We should solve challenges around workforce, that is attracting and retaining a qualified personnel pool for pathogen surveillance. We must solve for supply chain shortages and delays for equipment and consumables. And finally, we must solve for data sharing challenges. Here, the World Economic Forum, as the international organization for public-private partnership, offers a unique neutral platform to convene diverse stakeholders to tackle such global issues. In fact, our work on federated data systems is to bring value to the pathogen surveillance space. This is happening now, where we are working with a diverse set of public and private partners. Thank you.
Let's revolutionize our ability to detect, communicate, and rapidly respond to public health emergencies in the future. Join us in creating a renewed approach to epidemics and pandemics through future surveillance.